Hello and good morning. I'm your host, Jerry Bardall, and today we'll be talking about a recent medical marijuana movement within the Collegeville area. Currently, there are a number of dispensaries within the community that allow those that require medical marijuana easy access to their medication. However, there are a growing number of those who wish to see the dispensaries relocated. Let's take a look at a recent public service announcement advocating for less medical marijuana use in the Collegeville community.
Did you know that marijuana exposure can cause detrimental long-term health effects to our children? 75% of children whose caregivers report to using marijuana are found to be exposed to marijuana on a regular basis, many of which are due to secondhand highs caused from an older person. The long-term effects of marijuana include a psychological dependence on the drug, which promotes addiction to marijuana, or in some cases, other drugs. Marijuana is also proven to increase your chances of lung cancer by a significant percentage. Many of the respiratory symptoms experienced by those exposed to marijuana include a daily cough, chronic bronchitis, and frequent chest colds. These are the same symptoms found in those who regularly use tobacco products. Would you give your 8-year-old a cigarette? Protect them from secondhand marijuana intake. Don't legalize marijuana.
Now with us today, we have Tyler Falco, who is a leading medical marijuana researcher and expert. Tyler, after viewing this video, what are your initial thoughts?
Jerry, I'd first like to say thank you for having me on the show today. And there's a lot to unpack from this ad. I personally think it's misleading to the overall benefits that dispensaries and medical marijuana provide to the community.
With your professional experiences in mind, why might this ad be a little bit misleading to the viewers?
This ad speaks to the health concerns that are involved in smoking marijuana. However, most medical marijuana is ingested rather than smoked. We only see the smoking of medical marijuana when its calming effects are needed immediately by the patient. Even in this case, it is instructed to be smoked in a controlled environment where secondhand smoke exposure to children is essentially impossible. Additionally, the access that dispensaries provide to patients that are prescribed medical marijuana is essential for convenience of access of medication. This is an individual right that all patients should have.
Those are very interesting points to consider. Tyler, thank you again for coming on today and for sharing your knowledge with our viewers.